Did you know that a ketogenic diet can reverse mental illness in some cases? My name is Dr. Ruth Doughton. I'm a board certified adult psychiatrist, and I'm a metabolic psychiatrist, which means that I look at the overlap between mental health and metabolic health. And a ketogenic diet is one of our most powerful interventions. Now, just a disclaimer, there can be risks associated with the ketogenic diet, and it's not clinically appropriate for everyone. So make sure that if you're thinking about potentially trying this out, that you talk with your medical and or mental health provider to see if it might be right for you. So that being said, let me talk a little bit more about the history of the ketogenic diet. So the ketogenic diet was developed in the 1920s as a treatment alternative for treatment refractory epilepsy in children. And it's been found through multiple randomized controlled trials in both children and adults to be very effective in the treatment of seizures in these individuals. Now, of course, we also use a lot of seizure medications in our treatment of mental illness. Things like valproic acid, lamotrigine, topiramate, gabapentin, oxcarbazepine, and carbamazepine. So it stands to reason that maybe this type of dietary intervention could also be helpful for mental health symptoms. And we found that it is. So there's a growing number of studies and evidence showing the benefits of ketogenic diet for a myriad of mental health conditions, as well as neurologic, including things like schizophrenia, bipolar disorder, anxiety, depression, binge eating disorder, OCD, autism, ADHD, Parkinson's disease, Huntington's disease, Alzheimer's disease. You can see there's a lot of different indications, and that's because this diet is essentially good for brain health. So the way it works is that you lower your insulin levels enough so that fat burning turns on as a supplemental fuel source in addition to carbohydrates. So you can think of your body as a hybrid vehicle. So it can either run on carbohydrates or it can run on ketones. And of course, when it's running on ketones, it's really still running on a mixture of carbohydrates and ketones. But each of these fuel sources have pluses and negatives. So with carbohydrates, it's a fast burning fuel. So you're gonna get that energy really quickly. And there are certainly some cells that require carbohydrates for energy, but it's also gonna cause more inflammation, more oxidative stress. And if there's insulin resistance, that's gonna be an issue. Burning ketones, which is a metabolite of fat, in contrast, is going to be a slower burning fuel source, and it's much cleaner in terms of not causing as much oxidative stress or inflammation. Of course, like I said, some of your cells are going to require carbohydrates and can't run on fat alone. So you can see that if you're burning fat rather than just carbohydrates, that you're going to be decreasing the inflammation, the oxidative stress, and if you're someone who has insulin resistance, it's not an issue because you're burning fat instead of those carbohydrates. Now, it's important to say that this intervention is something that should be used in combination with psychiatric medications. Please do not stop your medications and start a ketogenic diet. While some people, once they're in a steady state of ketosis and have had a significant improvement in their symptoms, are able to safely reduce their dosages or even completely get off their medications in some cases, a lot of people do best with both, and it's certainly not safe to stop your medications before you're in a steady state of ketosis or without the supervision of your prescriber. Usually we don't recommend any medication changes until you've been in ketosis for at least 12 weeks. If you have any experience with the ketogenic diet and want to share, please go ahead and put it in the comments. I'd love to hear about it. Wishing you all good mental health today, and I'll see you in the next one.